Good afternoon, everyone, and welcome to this conversation on the impacts of climate change on perinatal and pediatric health. I'm Joe Waters. I'm the co-founder and CEO of Capita, and we're delighted to welcome those of you who are watching live and those of you who will watch down the road. We have a great conversation today between Greg Wallenius and Megha Agarwal, and we will get right to it. Greg is an epidemiologist and a professor at Boston University, where he leads the brand new, I want to make sure I get this right, the brand new Center for Climate Change and Health in the School of Public Health. I believe that is correct. Greg, I hope you'll correct me if it's not. And Megha is the executive director of the Monarch Foundation in New York City, which is doing a ton of interesting work related to early childhood, related to improving outcomes for children and families, and certainly also very interesting work on climate change as well. I'm going to turn the conversation over to Megha, who will guide the conversation fireside chat style with Greg today, and we'll welcome them now. Megha?
Hi, thanks so much for having me. I'm excited to be here and be in conversation with you, Greg. First, I would love to just open up the field to learn a little bit more about the work that you do. I know we just got a great introduction from Joe, but anything else that you can share about what it is that you're actually studying and how that relates to the conversation that we're having today.
Yeah, that's great. Thanks, Megha. Great to be with you today. And thanks, Joe, for the invitation and organizing us today. So, climate change is this really big problem. We hear a lot about it on the news. And, for a long time, this was framed as an environmental problem. We should care about climate change because it's destroying or harming our environment. And that's true. But I think the real reason we care about climate change is because we have to live on this planet. So it's impacting our opportunity to live well and live healthy for us today, not our families and not some distant people in the far future, but our families and our communities today. And so a lot of my research has been focused on documenting and understanding the health impacts of climate change, how climate change, things that are changing in a rapidly changing world are affecting our health and well-being today. Things like extreme heat, like air pollution, like hurricanes. These are threats to our health today. And if we can better understand those connections between those events and our health, then we can learn to better prepare for them and become more resilient. So that's what my work has been focused on, and we have a very large community at Boston University that works in this space. So our new Center on Climate and Health is hoping to bring together people that are working in this space and help them be even more successful and visible than they have been to date.
That's incredible. And I mean, even what you said right at the beginning really resonates. I think climate change for a lot of people can be this massive issue that we're dealing with. And maybe it's something that we're dealing with decades or even centuries from now. But I think that's just not the reality, particularly when you look at it with kind of a public health lens. So it's interesting to hear about that, and honestly great to hear about the types of communities that already exist to kind of combat this. I'd love to center the conversation a little bit around what Joe even kicked off with, the impacts of climate change specifically on perinatal and pediatric health and for child flourishing. Obviously cognizant that children then continue to grow, and then it becomes an issue for adult health as well as has impacts on adults who are actually raising the children that we're speaking of. So I'd love to get a sense from you of kind of what are the most intense impacts that we're seeing right now of climate change on child health? Like, how does it actually show itself and show up?
Yeah, it's a great point. And so much of the research and attention has been on the impacts of climate relevant events on people's risk of dying, which dying is super important. But by and large, fortunately, kids don't die in high numbers. And so when we think about who's dying, is 80% of individuals in the U.S. that die are 65 or over. And so what we're realizing now is that really climate impacts people across the life course, from preconception all the way to end of life. And the impacts on children and during pregnancy are sort of, have received less attention, and in some ways have been a little bit more challenging to study. But what we're seeing now is a wide range of impacts. So if we take extreme heat as one particular example, we can dive into that a little bit further. And so if you think of the heat wave that affected the Pacific Northwest last summer, this was a major heat wave that was serious impacts on the state of Washington, state of Oregon, and across Western Canada. And we still don't quite have the final numbers, but the attention is largely on seniors and their health, and also to some extent outdoor workers, which are, we can dive into that as well. But then we have almost no insights into the impact on children. And we know that kids are not just little adults, but that they're uniquely vulnerable, and that they're perhaps less physiologically able to adapt to heat, but they're also maybe less aware, self-aware in terms of when they're feeling overwhelmed or ill, and when they might need, for example, to seek shelter or even need medical attention. The kids are, especially young children, might just be far less aware of that. And so as parents ourselves, we need to sort of be very aware of what our kids are feeling. And that might be really hard to judge, of when are they overheating, when are they becoming dehydrated. So it's an incredible challenge, both from how to study perspective, but also how to understand the health impacts. And what a number of papers now show is that the impacts of heat are not just in the elderly or even in the middle-aged. It's across the lifespan, and including the very youngest kids. So increased risk of emergency department visits, emergency room visits, increased amount of not just heat-related illnesses, but other illnesses that are exacerbated by days of high heat.
Yeah, absolutely. And I mean, even if you look at, say, prenatal experiences or experiences for babies before they even have the ability to speak, I mean, it's a lot of the times we're unable to actually understand the impact of things like this because of the fact that they can't advocate for themselves. We end up having to become the advocate on an issue that we don't actually really know that well. So it's really interesting. I do want to dive into a little bit of what you were talking about, saying that, I mean, the research just doesn't exist sometimes around some of this stuff, or it's very sparse where it does. So I'm wondering, from your perspective, what you see as kind of some of the roadblocks that have existed to date in terms of actually collecting data around this, creating awareness around the need, and then where we're going moving forward, and maybe where we are right now, having small successes with actually being able to prove out the need for this.
Yeah, I think those are all great questions. One of the challenges in studying the impacts of heat or other climate relevant hazards on pregnancy health and children's health is really the lack of data. So we have really good national data sets on mortality, on people, who's dying, when, where. We have data available from Medicare and to some extent Medicaid regarding sort of what's happening to, Medicare covers elderly individuals by and large, but it's much harder to get large data sets on pregnancies with the kind of detail that you need to actually do the types of studies we're talking about. And children's health, there's very few large scale data sets that can be used to sort of identify children, patterns in children's health. So we've been fortunate in my group and other, and colleagues have also been able to leverage large data sets available, for example, in New York City or New York State. We've used separately from those studies, my group has used studies of children with health insurance, or children that go to children's hospitals across the US. So these are sort of unique data resources that we have. So the biggest challenge has just been the availability of kind of big data to understand these questions. But the other aspect of this is that we haven't actually been asking the questions for that long. So what are the impacts of climate change on kids? Again, because we sort of inherently start by thinking about the risk of dying, then who's most vulnerable to dying? It's the elderly. And then, we work backwards from there to, well, who's getting sick. And children by and large are very resilient, but yet despite that, again, we're seeing these health effects. And so to go forward, I think to get attention, we need more research, because it's hard to get attention to a problem if you don't really know the size of the problem or the details about what are the impacts. And so I think there's multiple groups across the country and across the world working on sort of both the impacts of these climate-related hazards on pregnancy complications, and we can dive into that a bit more, into sort of early childhood growth, early childhood healthcare needs, and then into adolescence and beyond.
Yeah. No, it's fascinating. And you've mentioned heat, I think, quite a bit in terms of one of the biggest, I mean, of course, our globe is warming. Like, that is quite literally what is happening. And I think it ends up having direct impacts. What are some other ones that we're seeing in terms of climate impacts on children, and also just generations and people more broadly?
Yeah, it's a great question. So heat is one that is relatively well understood in terms of we can forecast heat. People sort of intuitively know that it's at least uncomfortable. Some people realize it's also dangerous to your health. But then other hazards might include the smoke from wildfires, which are becoming more common, more severe, more extensive. Just on the news this morning, I heard they were talking about fires in the southwestern U.S. and saying, gosh, during fire season, if we can even call it a fire season anymore, because they're sort of extending more and more year round. So of course the fires themselves threaten the local communities, but the smoke from those wildfires can extend, hundreds or thousands of miles away and influence the health of much larger populations. So there's emerging studies now on the impact of wildfire smoke on pregnancy outcomes, pregnancy risks, childhood, particularly around asthma and other respiratory diseases. So wildfire smoke is one that's climate relevant. Another one is hurricanes. So again, we sort of are familiar with the destruction that hurricanes cause, or can potentially cause, and we're also aware sort of the reports of how many people die during the hurricane, primarily from injury. But really, much of the burden of or the health impacts of hurricanes comes in the days after a hurricane, when there's no power and maybe there's high heat, or maybe people don't have access to healthcare in the same way. And so we're just starting to understand what might be the health impacts of hurricanes. For instance, there's a recent study showed that there's hurricanes are associated with a higher risk of preterm birth amongst pregnant women. So whether that's the stress of the hurricane coming, or the stress of trying to board up your house or make other preparations, or the disruption in care that you experience in that time frame, hard to tell, but some important effects across the life course.
No, that's really interesting, especially that last bit you mentioned, I think, about leading to preterm births. I think there is that stress aspect, I think, to a lot of what we're speaking about. And I think a lot of climate change impacts can lead to increased levels of anxiety, increased levels of undue stress. So I guess, have you also seen, or is there data surrounding the impact on mental health, whether that's for adults or children more specifically? Of course, cognizant, it's probably harder to track in children.
Yeah, it's such a fascinating question, because I think there's a wide awareness in the research community that all these factors and threats must be influencing people's mental health. And sort of we kind of take it as a given, but there's not a ton of evidence to show that's true. There was a recent paper by a colleague of mine, Dr. Amrita Nori Sarma at Boston University, that actually documented, more emergency room visits for mental health conditions associated with days of extreme heat. And that builds on a larger literature showing that people's judgment is impaired. There seems to be more violence on very hot days. There's another study from colleagues at Harvard that showed that your ability to do of students to do math, basic math operations, is impaired on very hot days if they don't have air conditioning. And so there's injuries are more common on very hot days. There's some studies showing that. So clearly has an impact on mental health. But you're right. It's, particularly in children and I don't believe there's any studies about mental health in pregnant women associated with these, climate hazards. So again, we suspect that the health effects are there, but we really need to keep working to document those so that we can address them appropriately.
Yeah. Absolutely. I mean, and it's interesting because we're talking about two extremely vulnerable populations. That's pregnant people and babies and children. So, I mean, of course, should be there at the top of the list. It's what fuels our future generations. But I mean, it's tough, and there needs to be investment, and there needs to kind of be funding towards collecting that data and acting upon it. One other thing that I'm interested to hear from you is, I mean, you'll have a lot of maybe non-believers say, well, we've been dealing with climate change in one capacity or another for the past 100 years. Even if you look at, say, 500 years ago to where we are today, climate has shifted and it's adapted. And we as humans and our children are, as you had mentioned prior, are resilient, and we also have adapted. So I guess my question for you is what makes this moment especially important? Are there ways that we can become more resilient and that we can rely on our children, our babies, and our pregnant people to become more resilient? Or is there actually a need for the intervention? And why is that so important in this moment in particular?
Yeah, I'm really glad you took the conversation in that direction. So John Holdren was the head of the White House Office of Science, Technology, and Policy under the Obama administration. And he's said at a talk one time, he said, look, climate change is going to require us to do some mitigation, which means reducing future emissions, some adaptation, which means, getting ready for some of the impacts that are unavoidable, and pain. And the choice that we have is just how much of each we do. The more mitigation and adaptation we do, the less pain and suffering we'll have. And I like that because it sort of shows you that, we really need all of the above. We do need to reduce our future emissions to avoid the worst scenarios that have been projected into the future of climate change. But we also know that the change is here. It's not in the future, it's in the present, and it's affecting everybody, although, as you mentioned, it affects some people more than others. And so we need to do what we can to make our communities and our families as resilient to these changes as possible. And then there's going to be some inescapable harm that comes from this, in the same way that we still see people dying from extreme heat. We still see people whose health and well-being is jeopardized by wildfires and their smoke, by hurricanes, etc., by Lyme disease and other vector-borne diseases, etc. So we're just what the choice we have as a society is how much of the mitigation adaptation we do to avoid the pain. And that actually gives me hope, because there's so much momentum right now in the world, in the country. And although politically this is a really challenging issue, when you talk to actual people, nobody's opposed to being healthier or to protecting themselves. And there's just again this incredible momentum in communities across the country and cities across the country. That's where the local action is, and in aggregate, that local action is really making a difference.
It's interesting to hear you say that. I mean, from your perspective, how much of this needs to be a policy first solution versus maybe a grassroots first solution? Does it start top up and then go down, or is it bottom up, or is it both, honestly?
It just has to be both, because there isn't time to shirk our responsibility and let the other side do it. And I've seen great success at the community level with communities proactively reducing their emissions in aggregate and creating ways to do that in a way that's not financially harmful to people, because people are also struggling financially, and so you don't want to say, okay, now let's all pay more for our electricity for some far off benefit or perceived far off benefit. So that's right. So let's do this in a way that's financially sustainable, but do it on a large scale at the city or town level. And then also, so there's these grassroots effort, and the federal government, the state government, and so these international agreements can be helpful to create an environment in which these actions are more attractive financially, more easier to implement from a policy point of view. So all of the above.
No, I'm sure that is always the answer, isn't it? All of the above.
Yeah.
I think one other player that we haven't spoken too much about, I mean, this is a public health issue. We've talked a little bit about public. I'm interested in the health side as well. And when you look at healthcare professionals, when you look at medical institutions, what role do they play in this? And have we seen, I mean, care shifting? Have we seen those institutions, those individuals start to understand climate change as a medical emergency, and what does that actually look like?
Yeah, absolutely. And I think there's three things to touch on with the healthcare industry. One is that an industry, they are, the healthcare industry is a huge emitter of greenhouse gases, of carbon dioxide and other gases that contribute to climate change. So as an industry, they need to sort of, do less harm
Mhm.
by being greener. And there's lots of really good efforts on that. I think this is a recognized problem. Healthcare Without Harm is a local organization, is a national organization based in Boston that does a ton of great work in this area and has some proven success. So that's one is sort of being less of a contributor to climate change. But then a second pillar is that your healthcare provider is amongst the most trusted voices in any community. So whether you see sort of physicians on making media appearances, or whether they're talking to individual patients, when you ask people who do they trust for sort of expert opinion, healthcare professionals are amongst the top, and so they have a communication role that I see has been growing, and you see lots of society, medical societies having position statements on the importance of climate change to health. The New England Journal of Medicine, which is one of the top medical journals, has published multiple thought pieces on how this is an important health and healthcare problem.
Mhm.
And then the third one is that particularly during disasters, the healthcare workers are at the front line of
Yeah.
responding. This is where we go to when we're feeling ill from that heat wave or the wildfire smoke. And so they're very much part of the solution on that front as well, because they are the frontline workers and need to be ready for the increased risk and the need for information, frankly, during those moments.
Yeah. No, it's fascinating. And I didn't actually even know that about institutions really contributing to the problem as much as the solution. So, I mean, that's always something to be cognizant and aware of, is how much of our systems are actually the issue. I mean, they're going to be the ones that have to move forward with solutions, but also part of it is mitigating what the harm that they're doing in the first place. I have
Yeah, and again, I see a tremendous amount of momentum where there's a number of large medical systems and hospitals leading on this issue from the inside. So not even being pressured from the outside necessarily to change,
great.
but being pressured by their own community and their own members and leadership to change.
Yeah, no, that's fascinating. You had an editorial in a special climate issue or climate change issue of the pediatric and perinatal epidemiology. I have a quote here. Actually, you wrote that failure to urgently address the reproductive, perinatal, and pediatric health impacts of climate change will perpetualize and worsen reproductive injustices, wherein the most marginalized populations will be deprived of their ability to procreate and safely parent their children. And that statement, I mean, that really stuck with me, because I think it shows you, honestly, there's massive implications for the future of humanity here, and for people and for their children and for future generations. And so I guess if there's one message that you really wanted to get across, whether that's to policymakers, to funders who could potentially push some of their capital towards this issue, kind of what would that message be, and what's the most immediate and kind of critically urgent thing that we can do to actually address these impacts?
Yeah, that's great. Thanks for raising that commentary and in particular that quote. And I just want to acknowledge the co-author on that commentary. It was co-written by my colleague Amelia Wesselink, also at Boston University, who really led a lot of the work on that issue. So I think the key message is that this is not a problem of the future. This is a problem of the now, and that everybody's at risk, everybody's affected in very real ways. And so let me just dive into a little bit about the very real ways. Is if if you live in coastal Rhode Island with more than 400 miles of coastline, sea level rise and coastal storms become a very big problem. If you live in an area, much of the western U.S. where you're impacted by wildfire smoke, that's going to be the dominant problem. And so this can be very personal and in a very localized way. So what's important to one person or one community might be very different than what's important to a different community. But in some way or another, we're all affected. Our health and well-being, sort of, broadly, is going to be affected regardless of who we are, where we live. That said, some people are much more impacted than others. And the real challenge and the sort of the thought behind that quote that you mentioned is that the burden of risk is disproportionately borne by those that are least able to cope. And so, we already see pregnancy complications are higher amongst communities of color than they are, amongst dominantly white populations. And that, many of the impacts of climate change and these climate hazards also differentially impact people and communities in those same ways. And so climate change is not only a risk in and of itself for our health, but it's also making worse the existing health disparities and environmental disparities that we're seeing. So this is really, from both a health perspective and sort of an equity perspective, a really important issue. To go forward, what do we need? We certainly need, I would argue, research, not just to better understand the problem, but to develop solutions. We're really good at describing the problem in some ways, and we've done less work on saying, okay, and here's what you do about it. And not just like, here's what somebody else should do about it, but here's what my community can do about it. Here's what my patient can do about it. Here's what my family can do about it. So very localized, personalized solutions. So that would be a great start. And then those solutions obviously cost money, and that's probably where governments need to step in, and at all levels of government, local, state, and federal government, to support, make those solutions possible and cost effective.
Absolutely. Well, it's a beautiful end point, I think, with a strong call to action. So I want to thank you for your time, for being here with us today. It was incredible to hear just a little bit more about this issue, particularly given that I think it is a space that not a lot of people naturally start to think about. I mean, it's something that's a second order, third order level of thinking when you think about climate change. And so, I mean, it's really interesting and important to hear more about this. So I want to thank you again for your time, and for being with us.
Great. Thank you so much for your time and the wonderful conversation.
Absolutely.